March 24th is a day set aside to create awareness on how to combat the global spread of tuberculosis. And this year's theme is Invest to End TB, Save Lives. Well, welcome to the Breakfast Show on TSLNIGERIA TV. This is Matters on Ground. My name is Osasoge Ibe. Let's dive into the conversation after this break. Welcome back. Today on the show, we're going to be having our questions answered, including yours, as we'll be discussing the topic, creating awareness on tuberculosis. I'm joined on set by my colleague, Abiodun Adebayo, and of course, our guest, Dr. Emmanuel Oriaburi. Welcome to the show.
Thank you.
Good to see you again, Abiodun. Looking sharp as always.
Thank you.
All right, so let's dive straight into the conversation, tuberculosis.
Yes. Okay, so tuberculosis, and we've heard a lot of stories and myths around it. I remember growing up, one of the myths I heard that, when a person is coughing, automatically that person has TB. So, and I don't think the conversation about TB is held often. So, what is TB? Just an overview of what tuberculosis is.
Okay, to be straightforward, TB is short for tuberculosis, and tuberculosis is a chest infection caused by Mycobacterium tuberculosis.
Okay.
So that's just the simple thing.
Yeah. Well, for you, maybe it's simple because you're in that field. So
Okay.
you just said something else that's further complicated. The small thing I knew before.
Seriously.
Yeah. So now, who is prone to have tuberculosis? Who can get tuberculosis, basically?
Okay, virtually everyone is at risk of tuberculosis. The current indices says that 9 million persons worldwide are at risk of tuberculosis, and 1/3 of the world population also at risk of having latent infection. So maybe when we go on with the discussion, we talked about what a latent infection is and
Yes.
what active tuberculosis infection is.
Okay.
So literally, it's more like saying 2 out of every 50 persons you see could just have an active tuberculosis infection.
Those are
Wow.
very staggering statistics.
Well.
So, what are the causes of tuberculosis?
Tuberculosis is actually caused by bacteria, a particular type of bacteria called Mycobacterium tuberculosis. There are different types of Mycobacterium. Okay, you have the type that causes leprosy, but the particular one that is more common, of which we are all at risk, is Mycobacterium tuberculosis. So it's a type of bacteria that is spread via aerosols, like now that I'm talking, laughing or sneezing, and fleas coming out from either my mouth or aerosols from my nostrils, and somebody inhaling it stands a risk of being infected.
Okay. So earlier she talked about symptoms. I can relate with her story quite on a very huge scale. I remember growing up in primary school, then we did not even know what TB actually meant, but when somebody around us coughs, we just say, TB, without even knowing what TB actually is. So apart from coughing, what are other symptoms of tuberculosis? How do I know that I have tuberculosis?
Okay, so this is quite dicey, because getting to know that you have tuberculosis as an infection is not something that is very straightforward.
Okay.
So like I said, those of us who live in, maybe I just talk about risk factors quickly, so I should be able to answer your question very well. Persons who live in overcrowded regions, in overcrowded areas, they stand the risk of coming down with tuberculosis, because it is spread via aerosols. It's an airborne disease. So the closer people are packed, the higher the risk of you inhaling the aerosols from the other person, who may likely be carrying a latent infection. Now, persons who live in sub-Saharan Africa, those who live in South America and those other areas that are less developed, they also stand at increased risk of having tuberculosis. Now, more importantly, persons who have compromised immune system, maybe HIV patients or patients with kidney failure, patients with liver failure, those patients whose immune system are not active as that of a competent normal person who is not sick, they stand at increased risk of having tuberculosis. So now when you live with those persons, you become a contact, and your chance of having tuberculosis as an infection increases. However, it's not everybody who has tuberculosis that have active infection. There's what we call latent infection.
Yes, you mentioned that
earlier. So yes,
so latent infection is I'm exposed to somebody who has tuberculosis. So in quotes, the bacterium is in my system, but it's not enough to cause symptoms. What are the symptoms I'm looking at? Like you mentioned, cough. It's actually a productive cough, not all types of cough. That means you are coughing, you are able to cough out something. So that's the difference. So not just anybody just have a cough has tuberculosis.
Okay.
So that one should be corrected. It's a productive cough, the type of cough that you are able to produce something, what we call sputum. And if it's becoming severe, the sputum will be blood stained. Yes, so you see that for very severe cases. So when somebody is having cough that is 2 weeks or more, which is 8 weeks, some books will say 6 weeks. So when you have someone who's having productive cough for more than 6 weeks, that person should be screened for tuberculosis. Then you could have night sweat. You are sleeping under the AC, you are sleeping under the fan, the environment is not so hot in quotes, and yet you are sweating as though you are being poured water. That's night sweat. So that person should be screened for tuberculosis. Then there's unexplained weight loss. Somebody you see today, you are seeing the person in 4 weeks' time, the person have emaciated, and you could notice that the clothes the person used to wear that was so tight-fitted is now blown easily away by the breeze. That kind of person is that should be screened for tuberculosis. There are other symptoms that are not so classical, like having a low-grade fever. Your body is not so hot, but you know your temperature is not just normal. Just on the baseline, it's just hot, but not very hot. It's just there. We call it low-grade fevers. So those are the things that you put together and say, okay, this person standing a chance of probably a TB patient, so we should screen.
Okay, so a lot of these things you just mentioned now are giving me quite the scare because I'm an overthinker, especially that weight thing. So maybe I put on a pair of jeans today and tomorrow it's a little saggy around the waist. I'm here thinking, oh my God, what's happening to me, you know? So now, talking about going for screening, how is tuberculosis diagnosed? So I just walk into a hospital.
Okay. So I'll be quick with this.
Okay.
There's what we call tuberculin test. I'm sure most of us have done this test before. When you go to an hospital, they use a needle, a particular needle, and just inject a certain chemical into your skin, and they use a marker pen just to circle it, and they tell you to come back in 48 hours. They want to see the size of the increase. Now that's a tuberculin test. It is the commonest test for screening. So there is a particular size of that reaction that is expected for a normal person, for somebody who has active infection. When we say active infection, we mean an infection that has symptoms. I get it. It's just a common thing. I could have malaria. Maybe if you go and do a test for me now, I could have a plus of malaria, but you can't see any symptoms. I'm totally fine. I'm moving ahead with my life and everything. Now, somebody has just 1 plus of malaria and the person is in the hospital. So we say that person is symptomatic and the other person is not. So any tuberculosis infection that is associated with symptoms, we say it's an active infection. So for people with active infection, there is the size that you are expected. We use 5, 10, and 15. For somebody who has HIV, severe kidney disease, anybody who is immunosuppressed, if that size of that tuberculin test is up to 5 or more millimeters in terms of size, we say that person have an active infection. Okay. Now, for somebody who is at risk, maybe you are exposed to somebody who has tuberculosis, or you are a health worker like me, and you are the size of your tuberculin reaction is up to about 10 or more, you should be they should zoom at you, because it shows that you are likely having either a latent infection, something that should be screened more. Therefore, the general population, for those who really don't have so much symptoms, it could get as much as 15 or more before you say, okay, let's take it down.
Like
the lower the risk, the higher the risk as it
yes,
is.
Okay, so talking about tuberculosis now, is it curable? Because I know that
100%.
Okay.
100% curable.
Okay.
That's a relief.
Yes, it is.
So, as children, we're giving vaccines. Most children are vaccinated against tuberculosis. And while doing research for the show, I saw that that vaccine gives protection up to 15 years.
Okay.
Okay, so as an adult, should I go and get revaccinated, or how do I go about it?
Okay. Well, most persons won't advocate for revaccination.
Okay.
So the vaccine we're talking about is the BCG vaccine. And the BCG vaccine is usually given within 48 hours after birth.
Okay.
And records have shown that since the onset of vaccination, the incidence of tuberculosis is actually on the downward trend. So it's not as common as it was some years ago. So it's gradually going down. So most cases of tuberculosis you see these days are people with compromised immune system, like we said, people with HIV, people on steroids, those IV drug users, people generally with a suppressed immune system. Because for an active person, when you get exposed to that organism, your body is able to pin it. Like that's the best word I will use. Your body it gets to your lungs because that's where they get to. They like air, and you know in your system, your lungs is where air is concentrated. So when it gets to your lungs, for an active person, your immune system will just pin it there. Are you getting it? And just like wall it off, create a fence around it, and it stays there. And so most times it will not give you any symptoms. So that's called a latent infection. You have it, but there are no symptoms. And a lot of persons will continue like that for many years without any symptom. But God forbid anything happens to your immune system and your immune system comes down. Are you getting it? That latent infection that has been there, lying dormant, doing nothing, will get reactivated. And that's called secondary infection. And it's usually not something to joke with.
Okay, this sounds like quite a lot. If you're out there, I'm sure, watching us right now, I'm sure you're picking up a thing or two from this. You can jot down your questions, leave it right there at the comment section. I'll definitely address it as soon as we get it. So now let's talk about the cure. I am relieved that there is a cure for this. So let's talk about the treatment method. How easy is it to get treated of tuberculosis? We know that in Nigeria things are quite sweet. So for the common man, how easy is it for them to tackle the issue of tuberculosis?
To be very candid, very candid, treatment for pulmonary tuberculosis, or what we just call tuberculosis, is very, very accessible.
Okay.
It's actually free. Like, yes, it's actually very free. You see, we have international partners, world health organizations and their partners who have made these medications free. So treatment for tuberculosis is free. I can say that categorically because I've had to treat people with tuberculosis and it was literally at no cost. Maybe the cost of getting a card. In fact, it has even been done to the extent that they don't even have to get a card. Or if they come and you can make the diagnosis that it's tuberculosis, every other stuff that they are paid could probably be refunded because it's free treatment, literally. Now the medications, there are medications like antibiotics you take. For somebody with an active infection, the person is to be treated for 6 months. So for the first 2 months, the person uses a combination of 4 antibiotics, and then for the last 4 months, the person uses a combination of just 2 antibiotics. Except maybe at the end of the 2 months, the infection load is seems to be very high. And it is very accessible. Like I don't know if I'm permitted to mention names of hospitals where you could find it. If you go to where I was trained, University of Benin Teaching Hospital, there's what is called like the direct...
I want to ask, is this free treatment relegated to only government hospitals?
No. The truth is, the capacity of the private hospital has to be assessed before those medications are given. Although they are free in quotes, but they are very expensive. So if you don't trust that this private hospital will give it to this patient for free, are you getting it? So it is easier to just limit it to a center that has integrity or to a government centers. And that's why most times it is easily accessible in government setup than in private hospitals. But treatment for tuberculosis is free.
Okay, so let's talk about the fatality. So as you are in the business, so have you ever dealt with any condition that got so worse that the person had to die?
Yes.
Okay.
First of all, the mortality rate for tuberculosis is over 2 million deaths per year.
Wow.
So that's quite huge.
Scary.
Although a lot of effort is being made to beat down that number. Okay. However, the challenge is that people don't report early. So it's a general Nigerian condition, not just Nigeria actually, it's a general worldwide condition. So people don't report stuff like that early. So they come in when they are already too weak to respond to treatment most times. And so, of course, that tells you why the mortality rate is that high. Okay, yes, I've had to manage a lot of patients who had to eventually go, but most of them are AIDS patients.
Okay.
So I don't think I've managed a patient who is non-HIV patient, who is not immunosuppressed, that have had to die from tuberculosis. No, I have not.
HIV and AIDS
Yes, and other
more
immune conditions are at risk, and they stand the chance of having severe form of it.
Okay, so we're taking a lot of time, but this is the last question. What are the preventative measures that I can take as a person who's just going about their normal life? Preventive measures that we can take. And
first of all, everybody is doing that right now, and I want to commend the efforts of the government. BCG vaccination, like I said, it has driven down, caused the downward trend of tuberculosis incidence. So we should encourage that. Even if a woman gives birth at a non-government setup or a non-hospital setting, that woman should be encouraged to give BCG vaccination to the baby as much as possible, as early as possible. That helps. Then reduce exposure. If you know somebody has chronic cough, a cough that is lasting more than 6 weeks and is productive, not dry cough. Dry cough have other causes. So productive cough, that's the classical sign. Is coughing and is able to produce something. Some of them, you see them with an handkerchief and all kinds of stuff. Try as much as possible to stay away from such persons. Or if you have to deal with such persons, probably use a face mask. Okay. Actually, that's more essence of face mask rather than the COVID. So you use the face mask for that, right? So it's very, very important. Then, more importantly, other risk factors we talked about, overcrowding. So that one has a lot to do with the government and individuals. So you try to reduce overcrowding natures of our cities, overcrowding natures of most buildings. You still see a family who are up to 8 or even 7 or 9 staying in a one-bedroom apartment or one-room apartment. Everybody is there. You are breathing in, the other person is breathing out. So you can understand. So all these things, when they are well controlled, overcrowding is controlled. BCG vaccination is on the increase. People are being encouraged to take it up, and those who take care of people who are known to have active infection take precautionary measures. I'm sure that will help and go a long way to prevent you contracting pulmonary TB.
Okay, thank you so much for answering our questions. We have more questions, of course, but we're running out of time now.
Yes, I know it's been an interesting conversation, educative as well. I've learned a lot today, and I know that you have too. Yes, however, this conversation should not only be had when it's World Tuberculosis Day. It is something that needs to be talked about because this is an infectious disease that is killing people all over the world. This is TSL Nigeria TV. Remember that you can follow us on all of the social media handles. Leave your questions, if you have questions, in the comment section. Anyways, that's it for today. My name is Abiodun Adebayo, signing out. Until next time, bye-bye.
Stay connected to TSL Nigeria and get updates on the go all day, every day. Subscribe to our YouTube channel on TSL Nigeria Space TV and join our online family.